Hi, I'm Seema Mohapatra, and I am talking about the Feminist Judgments Rewritten Health Law Opinions book that Lindsay Wiley and I are co-editors of, and that has over 30 authors that have rewritten feminist judgments in various aspects of health law. Now, for my workshop, I had the students read a draft of the introductory chapter and give me suggestions about what was good from a student perspective as we anticipate the readers to be mostly students and professors that assign the book to students. Now, I wanted to kind of introduce you to the Feminist Judgment series and talk about why we thought that a health law volume was much needed. Now, the Feminist Judgment series basically re-envisions opinions from a feminist perspective. And the rules for the authors are that they must follow the precedent that was in place at the time that the judgment was written and any materials that were available at the time. And the purpose of the exercise is to show that even things, opinions that we see as neutral and not having any kind of gender influence are normed based on what's going on, what influences judges have, what their lived experience is, and how they define what norms are. Now, for the Feminist Judgments Rewritten Health Law Opinion series, we took the advice of an advisory board that was made up of many health law scholars, including authors of the main health law textbooks, to find out what opinions they thought were ripe for feminist retelling. And we define feminism very broadly, and we let authors decide what their definition of feminism was. And we had a commentary author that basically situated each opinion from in the context of health law or bioethics and talked about how the rewritten opinion differed from the original judgment and how the law would have changed if this rewritten opinion had been the law in place. Now, we used a wide variety of cases, from cases that are very familiar to most health law audiences, like the NFIB Obamacare case, like Schlondorf, uh, which is usually used for informed consent, to Moore versus Regents, a bioethics opinion, to Bouvier, to some more newer opinions, so that we could have a wide aspect of decision making regarding healthcare involved. Now, we had a great group of authors that were chosen from a public call for authorship. And we've been working on this project for the last couple of years with these authors. And we look forward to everybody being able to read this book, which is coming out with Cambridge University Press in 2021. Now, health law is a field that's kind of ripe for the application of feminist perspectives. And there are many, we took a very broad view of what health law was. You can think of health law as anything that is governing the healthcare sector. Usually most health law books cover bioethics, cover financing and delivery of healthcare, cover public health, and cover medical negligence. And so we have all of those aspects represented by the very many opinions in the book and the authors that are represented in the book. And we have the concepts that the authors took in terms of their definitions of feminism were quite broad. So we had some authors focus on intersectionality. Some authors focus on the public-private divide and what the responsibilities of the state were towards its people. We had some authors that looked at health justice and looked at relational autonomy and what kinds of constraints people make their decisions based upon. Now, I look forward to having this book out. Professor Wiley and I do, and we look forward to the comments from the students. Thank you.